students, welcome to the platform of DBMCI and eGurukul. I am Dr. Ramyasree, your OBGYN guru. So I am doing the series of FMGE PYQs. So I'll be discussing the FMGE PYQs in a 10 minutes video so that whenever you're free, you can have a quick grasp on these videos so that you can just see what type of questions have been asked and how to answer them, right? So let's start with the session. A 36 weeks pregnant patient came with complaints of bleeding per vagina associated with pain. The FHR is absent and uterus is tender. What is the diagnosis and management? So whenever you're having a clinical scenario of pregnancy, always see the gestational age so that your differential diagnosis mainly differs as per the gestational age. So 36 weeks presenting with bleeding per vagina, this mainly tells us we are dealing with antepartum hemorrhage. So whenever bleeding is after the period of viability and before delivery, we call it as antepartum hemorrhage. So fetal heart rate is absent, so baby is dead. Uterus is tender and there is associated pain. So there's only one cause where you have painful vaginal bleeding, that is abruption. So remember guys, painless vaginal bleeding is seen with vasa previa and placenta previa. But painful vaginal bleeding is seen with abruption. And here the baby is also dead. So first and foremost, this is abruption. Now next you have to decide what should be the mode of delivery. So whenever you have abruption and fetal heart rate is present, but if there is a fetal distress, you will go for LSCS. Only in this condition you will go for LSCS in abruption. Only when baby is alive and there is fetal distress, you will go for LSCS. Rest all of the conditions, you will go for vaginal delivery itself. So FHS is present but there is no fetal distress, you give oxytocin augmentation and you do normal delivery. If FHS is absent and DIC is present, first correct the DIC and then you do the vaginal delivery. If FHS is absent and DIC is absent, directly you'll go for vaginal delivery. Okay? So vaginal delivery will be if possible, definitely do vaginal delivery. If it is not possible, like if she has transverse lie or 2 LSCS, then you can again go for LSCS. So basically, whenever you're having abruptio, only if there is fetal distress, you're going to go for LSCS. Rest all conditions, you can do vaginal delivery. If baby is alive and if baby doesn't have any fetal distress, you go for vaginal delivery. If baby is dead, check the mother status. Mother is having DIC, first correct the DIC and then do vaginal delivery. Mother does not have DIC, directly you go for vaginal delivery. Okay? So, as the baby is already dead here, what should be the mode of delivery which you are going to select? It is directly the vaginal delivery. Okay? Female having 14 weeks of intrauterine death. What is the agent of choice which should be used? So again, miscarriage, you had a lot of questions and especially the MTP methods. So whenever it crosses the second trimester, the drug of choice is usually misoprostol. Better than Mifi, oxytocin and methotrexate, misoprostol will be the drug of choice. So that 14 weeks of gestation, doctor started misoprostol dose 200 micrograms. How much maximum dose can be given? So actually the misoprostol beyond 14 weeks, so 14 to 24 weeks, you can give misoprostol 400 micrograms. It's not 200 micrograms, but it's actually 400 micrograms. And you can give either per rectal or sublingual or buccal or per vaginal. You should give every 3 hours. Maximum 5 doses. So based on that, we'll again stick to the maximum 5 doses. Although the dose here which they have given is 200, it's actually 400 and maximum you can give 5 doses. Okay. So 400 micrograms sublingually every 3 hours, maximum 5 doses. Cervical cancer is caused by, so we all know that cervical cancer is mainly caused by human papilloma virus. So HPV 16 and 18 are high risk for cervical cancer. Right? Whereas HPV 6 and 11 mainly causes genital warts. Whereas HPV 31 and 33 are associated with CIN. HPV 31 and 33 are mainly associated with CIN. Okay? Yeah, this also has been many times asked, like this type of questions. So depict the picture. So what is patau? So I'll tell you one first. What are these trisomies? How to remember? So 13 के एज में पटाना शुरू करना है. So trisomy 13 पटाओ. 18 के एज में एंगेज होना है. So trisomy 18 एडवर्ड. 21 के एज में सेटल डाउन. So trisomy 21 Downs. So we have Patau, Edward, and Downs. So what is this picture showing? So once clearly you check whether it is a trisomy at 13 or 18 or 21, then it will be easy for you to understand. So I see the trisomy at around 21. So this is a Down syndrome. Turner says 45XO. So near the 45XX, you will not see one more chromosome. That's all. Okay. Right. There was one picture like this also. So they have asked, what is this image showing? So this is a intra-operation where you're seeing a huge ovarian cyst. So this is an ovarian tumor. Okay. What is this? So this is copper T380A. How am I telling that this is copper T380A? Because arms are also wound with copper. This is given free by the Indian government and it is called Freedom 10. This is effective for 10 years. This is effective for 10 years. Female having inserted copper T 6 months ago, now she has amenorrhea since 2 cycles. What could be the reason? So when somebody has amenorrhea after copper T insertion and that too for 2 months, so that means there is failure of contraception. And failure of contraception results in usually ectopic pregnancy. So this is a ectopic pregnancy, right? So there was one more picture, something like these. So this, what you're observing here, like, full growth around the growth. So these are the these are the warts. So it's called Condyloma acuminata. And this one, if you observe, this is Condyloma lata. It's a flat lesion. Condyloma lata, it's a flat lesion. So Condyloma acuminata is mainly caused by HPV 6 and 11. Condyloma lata is caused by syphilis. That means Treponema pallidum. Treponema pallidum. So Condyloma acuminata picture came in the exam. Yes, you had this question also in your PYQ. So what is this anomaly? So this is a HSG picture, guys. If you're observing, this is a HSG picture. So it's a single cervix, single uterus which is bent to one side and a single fallopian tube. So this is a HSG picture and this is nothing but unicornuate uterus. Unicornuate uterus. So they can give you HSG pictures also. Previously, they also gave a pyosalping's picture. Okay. So you're understanding the benefit of these. I'm doing a quick recap of the PYQs, whenever you're free or like you're too much bugged off reading and you just want to relax, you can see this videos quickly revise some 10 questions like that in the 10 minutes. That's very good, right? A female with cesarean section delivery, baby normal, but placenta was adherent. It is due to. So why do we have the morbidly adherent placenta? Morbidly adherent placenta is mainly due to absence of the tabux fibroid layer. So instead of asking directly, they have asked in a clinical scenario. So why do we have this? We have mainly due to absence of tabux fibroid layer. So we have three types in the morbidly adherent. Accreta means adherent to the myometrium. A for A. Increta, I for I, invades the myometrium. Percreta, P for P, penetrates myometrium to reach perimetrium. Penetrates myometrium to reach perimetrium. Okay. Mother complains her baby refuses to take feeds. On examination, there is swelling in the breast associated with pain. Probable causes: mastitis, breast abscess, breast engorgement, sore nipple. So, when will baby refuse to take feeds is like when there is like too much milk coming out suddenly. Then usually babies refuse to take the milk. There is swelling in the breast associated with pain. So, this tells that breast is completely engorged with the breast milk. That's the reason why baby is also not able to take the milk, and mother is also having the pain and swelling. So mother has to first empty the breast and then baby will be able to suckle slow flow. So this is mainly breast engorgement. So she has to mainly empty the breast. Mainly she has to empty the breast. Okay. So that's for this 10 minutes video. I'll see you in the next video where I'll be discussing some more PYQs. Thank you so much, guys.